When it comes to weight loss injections, where you inject really matters. It all boils down to picking the right place for your injection, and this can make a huge difference in how the medication works and how comfortable you feel.
People are using injectable medications to try and lose weight.
Worst place to inject MOUNJARO for weight loss.
If you're on OZEMPIC or MOUNJARO and you don't think that injection sites are important, you're wrong.
My first 2 weeks, I did it in my upper thigh. After that, 2 weeks later, I did it in my belly, and I got really, really sick.
If you're trying to figure out the best way to get the most of your injections, you're not alone. Thousands of people are on the same boat, looking for ways to make their weight loss journey smoother and more effective. Make sure to watch this video until the end as we explore the best and worst injection sites, especially for those on weight loss injections. Hope you enjoy. MOUNJARO. For starters, the upper back part of the arm, the stomach near the belly button, and the upper part of the thigh are the three main areas approved by the manufacturer. But which one works best? And which one should you probably avoid? One of the worst places to inject based on experience is injecting in the same spot over and over again without rotating. This can lead to scar tissue buildup and, surprisingly, can even make the injections less effective over time. It's tempting to stick to one site, especially the stomach, which many find to be the most comfortable. However, consistently using the same spot can lead to discomfort and reduced results. The key here is to keep rotating between the approved sites to avoid these problems. On the flip side, one of the best places to inject for weight loss, according to many who've tried it, is the back of the upper arm. It's not the easiest to reach. You might need a friend to help, but it seems to be highly effective. In fact, rotating between the arm, thigh, and stomach, and even alternating sides, can keep the body on its toes and avoid the risk of one spot becoming too sensitive or building up scar tissue. Why does rotating between these injection sites matter? Aside from preventing scar tissue, it helps to keep the medication working optimally. Just like mixing up your workout routine can help you break through a fitness plateau, rotating injection sites can help maintain consistent weight loss results. Of course, it's important to follow the guidelines given by the manufacturer and consult a healthcare provider if unsure. But for those on their weight loss journey, rotating sites and trying new areas can make the process a lot smoother. So if you're finding yourself stuck or experiencing discomfort, it might be time to shake things up. Literally. Zepbound. One of the top recommended areas for Zepbound injections is the abdomen. This area is popular because it offers easy access and usually has enough fatty tissue to make the injection less painful. But here's a key tip. Always avoid injecting within 2 inches of your belly button. This small detail helps you avoid irritation or complications that could arise from injecting too close to that sensitive spot. Another great option is your outer thigh. The outer thigh provides a decent amount of subcutaneous tissue, which is exactly where Zepbound needs to go. One thing to keep in mind is to rotate your injection sites within the thigh. Sticking to the same area over and over can lead to tenderness, and no one wants that. The back of the upper arm is another viable option, especially if someone can help you with the injection. If you're doing it yourself, this area can be a bit tricky, but it's still a solid choice. Just make sure to pinch the skin and lift the fatty tissue before injecting, as this can help ensure the medication is delivered where it needs to go. But some areas should definitely be avoided. Injecting directly into muscle tissue is a big no. Not only is it painful, but it can also lead to inflammation and interfere with the drug's effectiveness. Zepbound is designed to be injected into fatty tissue, so hitting a muscle could mean you're not getting the full benefit of the medication. Another place to avoid is your veins. Injecting Zepbound intravenously can lead to serious complications, including severe side effects and a higher risk of infection. This method also prevents the medication from working as it should. Additionally, steer clear of any areas where the skin is bruised, tender, or irritated. Injecting into compromised skin can lead to infections and longer healing times, making your experience much more uncomfortable than it needs to be. Before you inject, take a moment to inspect your injection pen. Make sure it's not damaged and that it's at room temperature. This can improve the flow of the medication and make the injection easier. After injecting, if you notice any bleeding, just apply gentle pressure with a sterile cotton ball. Avoid Avoid massaging the area though, as this could affect how the drug is absorbed. By sticking to these guidelines, you'll not only minimize discomfort, but also ensure that Zepbound works as effectively as possible. OZEMPIC and Wegovy.
Anna McKenna has documented her 45-pound weight loss journey with Ozempic on YouTube.
Interestingly enough, it has been my easiest weight loss attempt and my most successful.
She agrees that Ozempic isn't a magic pill.
The abdomen is often the top choice for injecting semaglutide. It's easy to reach, and the fat in this area helps the medication absorb well. Just be sure to stay at least 2 inches away from your belly button to avoid any trouble with blood vessels. Another good spot is your outer thigh. Stick to the fleshy part to avoid any discomfort or hitting sensitive areas. The upper arm is also an option, but it might be tricky to do it on your own, so you may need a bit of help. To keep things comfortable, make sure to switch up your injection spots. If you use your right thigh this week, try your left thigh or abdomen next time. This rotation helps prevent skin irritation and ensures better absorption. Now, where should you avoid injecting Ozempic? Stay away from the areas with bruises, scars, or stretch marks. These spots may not absorb the medication properly, leading to inconsistent results. Also, never inject into a vein or muscle. Ozempic is also designed to be injected just under the skin, in the fat, not deeper. And always remember, clean the area with alcohol before injecting to avoid any risk of infection. If you notice any signs of infection like redness, swelling, or pain, make sure to reach out to your doctor right away. SAXENDA.
This medication particularly helps to control your appetite or helps to increase satiety. So that really can help a patient when they don't have the willpower.
SAXENDA, an FDA-approved injectable, is designed to help with chronic weight management, but the key to its effectiveness lies not just in the medication itself, but also in how and where it's injected. Well, there's no best place to inject. Studies show that your body absorbs SAXENDA in a similar way no matter where you choose to inject it. So the decision really comes down to what feels most comfortable for you. Many people find the stomach area to be the least painful. If you're more comfortable with your thigh, go ahead and use that spot. But when it comes to the upper arm, a little help might be needed. Reaching around to inject into the back of your arm can be tricky, so having someone assist you could make things easier. A good tip is to imagine your belly button as the center of a clock. One day, inject where 12 would be, and the next day move to 1. This way, you give your skin time to recover. One more thing, always make sure you're using healthy skin for your injections. Avoid areas that are bruised, cut, or damaged to ensure you're getting the full dose. By rotating injection sites and keeping the skin healthy, you can make the process a lot smoother. So, where will your next injection be? Decide wisely. Thanks for joining us. If you found this video informative, don't forget to hit that subscribe button and ring the bell for notifications. Let us know your opinions on this topic and comment down on this video if you have any questions so that we can assist you. Lastly, if you want to store your precious medications like insulin or other injectables, please visit our website linked in the description of this video and get yourself one of the best cooling solutions to store your meds at fridge temperature. Thanks for watching, and we'll see you in the next video.